This YCN segment is brought to you by H.R. Clough and Kearsarge Heating, your local energy specialist.
Home Care Matters is presented by the Lake Sunapee Region VNA and Hospice.
Today on Home Care Matters, the JAMA report looks at the shared financial incentives for both physicians and patients' improved cholesterol levels. I'm Jim Culhane. Lake Sunapee Region VNA and Hospice provides healthcare and hospice services, allowing continuity of care and helping people to stay in their homes as long as possible. To foster this mission, we provide the most up-to-date information about healthcare advancements, procedures, and products. In this vein, we present this edition of the JAMA report.
You want to get your vital signs this morning?
In addition to vital signs, a visit to the doctor's office often includes a discussion about cholesterol levels, especially if a patient is at high risk for cardiovascular disease.
You can substantially reduce that risk if you take statins or other medications to lower your cholesterol. Many patients aren't taking statins, or if they are, they stop them after a few months.
And what we did in this study was to test a variety of strategies to try to help patients and their doctors get their cholesterol under better control.
Drs. Kevin Volpe and David Ash from the University of Pennsylvania and co-authors studied the effect of different financial incentives on cholesterol levels in more than 1,500 patients at high risk for cardiovascular disease. The researchers randomly assigned 340 doctors to one of four groups. One group didn't receive any financial incentives. In another group, financial incentives were given only to the patients who showed improvements in their cholesterol. The study appears in JAMA, Journal of the American Medical Association.
If patients weren't on statins, they were started on statins, having both the provider intensify therapy as appropriate and having the patients take those medications once prescribed. And that's really why we think the shared incentive group was the most effective.
We shouldn't just think of these as mechanical economic transactions. Getting your cholesterol down is a team effort. It requires physicians to prescribe the medications, and it requires patients to take the medications.
Both of those are critically important to the end goal of improving LDL cholesterol and reducing cardiovascular risk.
Catherine Dolph, the JAMA report.
For more information about the services of Lake Sunapee Region VNA and Hospice, go to our website or give us a call. I'm Jim Culhane. See you next week for another Home Care Matters.
The Lake Sunapee Region VNA and Hospice, where home care matters.